The fourth outbreak of the COVID-19 pandemic is still very complicated. The number of infected cases in adjacent provinces is on the sharp rise. Along with the folks on the front line, medical workers in Cần Thơ city are continually struggling to do their job. By this time, there is a crucial need for mutual support and accompanying from organizations, individuals, with the aim to share pressure and ensure efficiency of control measures in an effort to contain the spread of the pandemic.
Apart from managing operations of health stations, doing professional jobs, and instructing people returning from epidemic-hit areas to make medical declaration, Dr. Trương Thanh Hội, head of the health station of Thường Thạnh Ward, and his colleagues in turn are also on standby at medical checkpoints in Cái Răng urban district, in the meantime organizing vaccination against COVID-19. Every day, medical workers at health stations also call or pay visit and offer consultation for self-quarantine at home. Care for families and themselves becomes an essential now. In total, there are nearly 3,000 cases placed in quarantine in the whole city at present. All of them are watched by employees of health stations. Our staff here encourage each other to unanimously try to overcome difficulties so as to control epidemic. At present, our staff is now still very energetic. The medical staff at hospitals, Cần Thơ City Center for Disease Control and district health stations are also very hardworking. They must be in charge of regular checkups while diverting testing and giving treatment for patients from across Mekong region. This contingent is also in charge of giving support for isolation work at 12 concentrated isolation zones, 35 medical checkpoints, and injecting vaccines for nearly 30,000 people. Physicians of our hospital worked very hard. We focused all of our workforce to limit to the least the spread and intrusion of the pandemic into the hospital. We are in the hollow areas of the pandemic. Consequently, we must be always at the highest alert. In recent days, my colleagues have been working around the clock and readily gone to any places to mobilize people to make medical declaration and go to concentrated quarantine zones when returning from epidemic-hit areas. When there is any signs of infection, day or night, sun or rain, we all volunteer to do our jobs as instructed by the city. During the past months, more than 8,000 medical workers in Cần Thơ City have postponed their own jobs and double or triple the working capacity, tried their best to fulfill mission with the aim to contribute to preventing the spread of the pandemic and protect people's health. This has created a great trust in the community, including foreigners living and working in Tây Đô or the Westland. The contingent of physicians plays a very important and good role, thereby just few cases have been reported in the city as of now, the least number across the entire country. Not only physicians but also volunteers at checkpoints have done a very good job. White blouse soldiers made no efforts with the single hope that people would be cooperative in making medical declaration in the honest and sufficient manners to reduce contact time, while carrying out the 5K message and going outside just in really crucial case to early control and fight back the pandemic together with the whole country.